Hey, Miss Guild, can you tell me today's date and the time?
7:30, and it is 9:30.
Okay. Could you tell me your name?
Taylor Gill,
Okay. Can you tell me your gender and your race?
female, white,
Okay. Can you tell me the address that this date or this interview is taking place at?
4100 Old Warren Road,
Okay. What city and state are we
Pine
in?
Bluff, Arkansas.
Okay. Could you tell me your telephone number?
8978044.
Okay. What about what brings you here? What kind of things are going on with you?
Just been having shortness of breath when I walk across the room.
Okay. What aggravates this shortness of breath that you're having?
Walking. Or
Walking.
anything.
Okay. Does anything alleviate that? Do you have any pain associated with that shortness of breath?
My chest sometimes hurts and my heart races.
Okay. All
But
right.
if I sit down, it goes away.
Okay. All right. So could you tell me about any major illnesses that you had maybe when you were a child or currently? Do you have
No, I don't have anything.
anything you've been diagnosed with? Okay. All right. Have you had any recent immunizations?
No, I'm up to date on all my shots.
Okay. So you had all your childhood immunizations. Okay. Have you had any serious injuries, disabilities, surgeries for these disabilities? Okay. Have you had any major transfusions, blood transfusions, any products? Okay. And do you consent to receiving blood products should you need some while you're here?
Yeah.
Okay. All right. What about any major hospitalizations?
No.
Okay. When's the last time you've been examined by a primary care physician or other medical staff?
Like a month ago.
Okay, like a month ago? All right. Do you get routine screenings, mammograms, anything like that? You do? Okay. All right. What kind of medications are you currently on?
Just birth control.
Okay. Do you have any allergies? Any allergies to medications? Anything?
No.
No known allergies? Okay. All right. What about your mental health? Would you say your mental health is okay?
Yeah.
Or okay. All right. What about any recent labs, diagnostic tests? Have you had any recent labs? Okay. So we might have to get some of those on you.
Okay.
What about your menstrual cycle? When's the last time you had a period? What's the flow like?
About a couple weeks ago.
Any spotting or abnormalities with that?
No.
When did you start having your menses? When did that start?
Like the first time?
Yeah,
like when I was like 15.
When you're 15, you've never had any problems menstruating or anything like that. Have you had any kids?
No.
Any live births? Okay. All right. So I'm gonna ask you about your family history. Does anything run in your family or any things that y'all see like cancer, diabetes, hypertension, thyroid disorders, any blood clotting problems?
I don't really have anything.
Not anything. No epilepsy. No arthritis.
Maybe arthritis.
Maybe arthritis. Okay. And where do you see that at in your family? Arthritis.
Like the women.
The women in your family. Okay. All right. So could you tell me a little bit about your family and your structural background? Are your parents married, divorced?
They're divorced.
Okay, are you married or divorced? Are you single?
I'm single.
You're single, okay. All right, so what do you do for work? What do you...
Respiratory therapy.
You're a respiratory therapist, so what's the highest level of education that you've had completed?
Associates.
Associate's degree, okay. All right, what do you like to do when you're home away from here?
Watch Netflix.
You like to watch Netflix, all right. So how would you say your health habits are? Do you go to the gym? Do you...
No.
You don't do anything like that? Okay. Have you been outside of the country or outside of the state, any major traveling here recently? Okay. What about your cultural background? Are you religious?
Yeah.
Do you do anything specifically?
No.
Okay, so what religion do you practice?
Just God.
Okay, all right. So do you do any self-care exams, possibly, checking out your breasts or anything like that? Okay. Sexual history, are you currently sexually active? Have you had problems with that? Any STDs, any STIs?
No.
Okay. So your general health, would you say it's good, or do you think that you're healthy? Have you ever been told that
I think I'm healthy.
you think you're healthy? Okay. So what about your skin? Have you got any dryness, itching, hives, redness, anything out of the normal? Okay. So what about your hair? Have you had any changes in hair loss, distribution, any discoloration? Okay. All right. What about your nails? Do you have problems with your nail thickness? Are they
They're normal.
okay? They're not okay. All right. What about your ears? Have you had any problems with ringing, hearing anything that you shouldn't be hearing? Any vertigo, loss of sensation in your ears?
No.
Okay. All right. What about your nose? Do you have problems smelling, discharge, itching, redness, anything out of the normal there? Okay. What about your mouth and throat? When's the last time you went for a dental exam?
A couple months ago.
Okay. All right. Do you have any problems swallowing, difficulty chewing, anything like that? Any pain? Okay, all right. So what about your lungs? You said that you had shortness of breath, dyspnea on exertion. So about that, do you have any problems with the cough? You know, your spit, does it have any, is it out of normal besides, you know, clear, white? Okay. When's the last time you had a chest x-ray?
It's been a long time.
Okay, I think we might have to do one of those on you. So what about your breast? You have any pain, tenderness, any discharge coming out of your nipples? Okay. So what about your heart? Have you been told that you have any arrhythmias, palpitations? You know, feeling like your heart's jumping out of your
Sometimes
chest?
it beats like that.
Sometimes it beats like that. Does it beat like that when you're short of breath?
Yeah.
It does. Okay. Are you able to walk up a flight of stairs,
No.
run, and all that? So
Not
is that one of the things you notice with the shortness of breath is when you're doing something? Okay. All right. So what about any problems vascular wise? Have you had any excess bleeding, bruising, anything like that? Okay. All right. So what about your stomach here? Have you had any problems or any changes in bowel movements, loss of appetite, any pain, tenderness there? So you had no issues with that? Okay. All right. What about your thyroid or have you had any swelling, redness, anything like that? What about cramping, anything like that? No cramping, no diabetes. What about, have you had any changes in, you know, when you pee, does it hurt? Does it sting? Does it burn? No changes to your vagina or anything like that? Okay. Have you had any miscolored stools, miscolored urine, anything like that? All right. So you told me you didn't have any children or no live births or anything like that. When's the last time you had a pap smear?
About a year ago.
About a year ago, and you got the full workup when you went to your OBGYN. Okay, and you do those pretty frequently. All right. So what about joint stiffness? Have you had any problems with your joints, doing anything, any stiffness, anything that feels out of normal? Okay. All right. So what about weakness? Have you had any weakness, paralysis, loss of sensation,
No.
night sweats, tremors, anything like that? Okay. What about your mental state? Do you have any bouts of depression?
No.
Any suicidal thoughts? Any indication of hurting somebody else or yourself? No? Okay. All right. So is there anything else before we start this physical exam that you would like me to know about you? Anything, any glaring issues? Okay.
No.
All right. So when I start this examination, I'm going to be looking at you first, and then I'll be touching you. Do you consent?
Yeah.
Be touched? Okay.
Yeah.
All right. So I'm going to look at Miss Gill. I'm going to come into the room. I'm going to look at Miss Gill. I'm noting her color. Noticing if anything's out of place. This is a Caucasian female, pretty dark. I don't notice anything right now, right off the bat. So I'm gonna look at her eyes and her ears, noting if everything is in line. You know, her skull, everything looks good. Nothing looks out of place. It looks okay for a female of her age. I'm looking at her ears. Both of those look like they're in place where they should be. I'm going to look at her hair. I'm looking at her hair. I'm looking at for any loss of hair, anything that looks out of place. It doesn't look like there's any patchiness, balding, or anything out of place with regards to that. So then I'm gonna check out her jaw here. I'm gonna place my hands here, and I want you to open, close your mouth. Okay? Can you protrude your? Okay, yeah. Can you bring it out for me? Can you bring it in for me? Okay. Everything looks good like with that. So could you show me your teeth? Smile for me. Frown for me. Could you raise your eyebrows? Could you clench your teeth for me? Okay. So we're done with that part. Could you wrinkle your head for me? So I'm looking at her eyebrows too as well when I'm doing this. Seeing if there's any, pain associated with me touching her face. Then I want you to close your eyelids for me. I'm going to palpate her eyelids, her lacrimal duct here. Any pain when I touch there? Okay. All right. So now we're going to look at her sclera, her general appearance of her eyes. Nothing looks out of place. She does have some redness to this right eye. Have you been slipping in your contacts? Okay, that's what it looks like. So I'm looking at her eyes, I'm looking at her sclera, looking at her conjunctiva.
looking at her irises. Right now on inspection, it looks like her irises are about, I'd say probably a 3 in both eyes, which is normal for her. So I'm gonna check your vision out here. Could you tell me? Could you close one eye and tell me what this says right here?
Awesome.
Are you able to see that? Okay. So when I back up from you, are you also able to see Austin in that as well? Okay. I want you to close the other eye. Could you tell me what this says right here? Do you have any?
Clear.
Okay. So when I step back, are you still able to see that clearly? Okay. All right. So now we're gonna test her her light reflection and also how well her eyes accommodate. So we're gonna get a light here. Can you look at me please? I'm gonna make sure the light is reflected equally in both eyes, and it is. And so while we're on that, we're gonna check her eye movement. So could you follow my eyes in all 6 directions? So I'm gonna go up, down, left, right. And it looks like her eyes accommodated well. There was no excess eye movements, and she followed those very well. So now I'm going to turn off the light here. I'm going to make sure her pupils react properly. All right. And they did. They became smaller when approached with light. Also, I have her eyes here. I'm going to look for a red reflex. Everything looks good in regards to that. Okay. All right. So now I'm going to go to her ears. I'm inspecting the alignment of her ears, making sure everything is where it should be, and they do protrude a little bit, but nothing abnormal here. I'm going to palpate her auricles here. Do you have any tenderness when I press there? Any tenderness in any part of your ear here? Okay. All right. So now I'm going to perform a whisper test, and I would like you to repeat the phrase that I say here. Could you cover that other ear for me? All right. Now cover this other ear for me. And what phrase did I just tell you there when I whispered your ear? Red. Okay, that's exactly what I told her. So now I'm going to look inside of her ear. I'm going to pull back here, Miss Gill. And the canals are in place like they should be. Pearly green temporal membrane there. And check this here. Everything looks good like it's supposed to. All right, so now we're gonna go to your nose here. I'm looking at where her nose falls on her face, and it looks like it's in a good position, nothing out of place. Have you had any nasal surgeries, anything like that? No, you haven't. Okay. So now I'm gonna look inside of her nose. They're pink, they're moist, there is hair in place, there's no excess drainage, no swelling. Okay, and could you please close one nose for me, breathe out of that other side of that nose, and then do the same on the opposite side? Did you have any problems breathing when you did that? Okay, all right. So now we're gonna look at her mouth, her nose, or not her mouth, her nose, her mouth. Could you open up your mouth for me, please? Her lips look pink, moist, in place. Could you open your mouth again for me? So now I'm looking at her teeth, they're white. Everything's okay with that. I'm looking at her lips, her gums.
Watch out, baby.
Please go back in your room. Look up your tongue for me. Could you say ah? Okay. And I see the back of her mouth there. I'm looking at her throat. Open your mouth back up for me, please. I'm looking at her uvula there. Everything looks in place and where it should be. And now we're going to, could you take a sip of water for me, please? Make sure that you can swallow properly. All right. Everything go down fine where it's supposed to. Okay, so now I'm gonna look at her neck. Could you straighten your neck out for me? Everything looks in place. I don't see any enlargement of the thyroid. I don't see any tracheal deviation there. Could you please shrug your shoulders up for me? Could you bring those back for me? Okay, forward for me. All right. So now I'm gonna palpate her carotid pulses here.
I'm not gonna do that bilaterally because I don't want her to faint. Do it on this side. All right. Now I'm gonna check out her lymph nodes. I got her preauricular here, her postauricular here, her occipital way back here, her cervical chain right here, deep cervical chain back here, her supraclavicular nodes here. Let's get back here. And then we got her submental up here. And like I said, her deep cervical chain looks fine. Any tenderness when I press, and I don't notice any swelling of the neck. Nothing like that, so everything looks fine with that. So now I'm gonna check out her hands, her arms. Everything looks fine. She's warm to temperature. You go ahead and squeeze my hands. I'm checking her grip strength here, and she's pretty strong. Looking at her arms here. No edema that I've noticed here. I'm pressing down. I'm gonna check out her pulses as well while I'm down here. I'm gonna check your radial pulse. There's a +2 there. Straighten out your arm for me. Brachial pulse here, that's also a +2. I'm gonna check this other side right here as well. Check her brachial pulse. I'm gonna check her nodes back here on the back of her elbow. There's no swelling, no tenderness there. No swelling, no tenderness there as well. Okay, so now I'm looking at her thoracic cavity here. Also taking note of her respiratory rate, rhythm, pattern. She doesn't seem to be in any kind of distress. No shortness of breath noted as well. I'm gonna put my hands back here, and I just want you to take some deep breaths for me, and I'm gonna check her thoracic expansion. Deep breaths for me, deep breaths, deep breaths, deep breaths, deep breaths. Okay, and I'm also going to test her for tactile firmness. I'm going to put my hands back here, and I want you to say 99 while I move my hands down.
99.
Okay.
99.
All right.
99.
All right.
99.
All right.
99.
All right. So I'm also, while I'm here, I'm going to percuss back here to see if there's any tenderness by our kidneys. Is there any tenderness when I press down here? All right. So I'm also going to listen to you as well. Take deep breaths for me. Okay. Deep breaths. Deep breaths. I do on the back. Deep breaths. Deep breaths. Deep breaths. I'm also going to palpate her axillary nodes here, see if there's any swelling, any tenderness when I press down on you. Okay. All right, so I also need to listen to your heart here. All right, go ahead and lean forward for me, please. I'm also going to do the same thing. Okay. Then I want you to pull yourself back here, and I'm also going to do the same thing. Normal S1, S2 heard on auscultation. I didn't feel any palpations, but I'm also going to feel over here, make sure I don't feel any thrills, no heaving, no excess pulsations felt there. Okay, and so I've already listened to her heart sounds. Now I need you to turn to the left for me, and I'm also going to do the same thing. You turn the light back on. That's probably not gonna help anything. All right, so now I'm gonna look at her abdomen. Could you sit up straight for me? I'm noting her posture and everything looks fine with that. I'm noticing her contour here. Nothing looks out of place there. I'm also gonna auscultate her bowel sounds. And I could hear peristalsis taking place, active bowel sounds. So now I'm going to percuss her abdomen. Any tenderness when I press, okay, and her abdomen goes back into place whenever I press down on that. So now I'm going to feel your abdomen here. There's no swelling. Seems like there's no presence of fluid in the abdomen. I'm going to palpate your midline, so sit up straight for me. I'm not feeling any pulsations, anything like that, nothing out of place there as well. And I'm also going to look at her abdomen as she sits up straight with her head straight. Everything falls like it should. Her chest is in front of her abdomen like it should be. So now we're going to look at her feet and her legs. So I'm just taking a look at her general appearance. Like I said earlier, she's darker than most Caucasians here. I'm gonna look at her hair distribution. Doesn't seem like she has any hair on her legs, which is abnormal for a female that shaves her legs. Now I'm gonna look at her. I'm gonna feel her temperature on both legs. She's warm to cool in touch. While I'm down here, I'm going to check her popliteal pulse on the back of her knee here. +2 there, +2 there as well. Now I'm going to check her tibial pulse here. If I can find it, there we go. Alright. Alright, so we're also going to check here as well. Everything feels fine there. Dorsalis pedis pulse right here. If I can find it. There we go. Alright. Dorsalis pedis pulse as well. Alright. Just go ahead and press your toes down on my foot or my hand there. Alright. That as well. Could you go ahead and do your feet like that as well for me? Alright. I'm not seeing any evidence of clonus there in her feet. Looks like she's got strong range of motion. Go ahead and press down back and forth on the foot there like you're pressing the gas pedal. Alright, so she got full range of motion of the feet there. So I want you to stand up for me. We're going to test your hips here. Could you move one leg this way, inside there, forward and back for me? Alright, can we do the other side there? Looks like she's got full range of motion of the hips. Do that as well for me. Let's go ahead and press up against my leg while you're doing that as well. Alright, do that other side. Here, let's do this other side. Alright, seems like she's got a lot of strength in her hips as well. So now I'm going to, you can sit back down for me, Miss Gill. Could you tell me if you feel a dull or sharp sensation in your part of your body? Alright, what about that? What does that feel like?
Dull.
Okay, let me see your other hand. Close your eyes for me. What does this feel like?
Dull.
Dull? Well, that was sharp, okay. What about this? Can you feel it? What does this feel like?
Dull.
Dull? What about this?
Sharp.
Sharp, okay. What about this? What do you feel in this?
Sharp.
Sharp? What about this over here?
Dull.
Alright. What about this? When I press down on your feet, what do you feel?
Dull.
Okay. What about this?
Sharp.
Sharp? Alright. Now, I want you to put both your hands out in front of you, both thumbs up, and I want you to alternate going up, down, up, down. So you're gonna alternate movements, okay? All right, looks like she can do that as well, just fine. So now I'm gonna percuss her tendons here. All right, looks like there's no abnormalities there as well.
Let me see your leg here. All right, I don't have proper materials here to do this. All right, do this as well. I don't see any kicking of the foot, anything abnormal there as well. We've already tested the clonus there. What about your feet? Are you able to put your feet on the, okay, yeah, just do that for me. All right, looks like she can do that as well. All right, so now I want you to get up and I want you to put your heel in front of your toe and walk in a straight line for me. And you can just walk, right there in front of the camera for me, all right? And come back and do the same thing the other way. And then don't sit down, but stand in front of your chair there, all right? So now I want you on one foot, I want you to rotate with the other one that you were not standing on. Okay, looks like she can do that just fine. Do that for the other side for me. All right, everything looks fine. All right, so stand up for me still as well. So now I'm looking at her spine here. I'm gonna palpate her spine. Everything seems to be midline. You've never been told you have scoliosis or anything like that as well, right? Okay. All right. So now I want you to lean forward for me. And I'm also auscultating this as well, making sure everything's where it should be, and it is. All right, so come back for me. Lean back. All right. Can you kind of rotate like that? All right, and I'm also inspecting this as well. Go back the other way for me. All right, you can sit back down for me, Miss Gill. This concludes our physical assessment here. Thank you so much. Do you have any questions for us? All right, thank you so much.
Thank you.